Your money funding a healthcare system with possible problems.
I think any time that you're talking about something as complex as this, there's always going to be problems.
The state's MyCare Ohio program is supposed to simplify health insurance for patients eligible for both Medicare and Medicaid. Only on News 5, Kevin Berry found a mother who says her family is being left behind.
A hand on the back or head is sometimes the best Theresa Sweeny can do for her 22-year-old son, Noah. He's one of the Ohioans in 29 counties whose care is coordinated through MyCare Ohio, an experiment to streamline services for people who are on both Medicaid and Medicare.
Noah has an ultra-rare disease that no one in the state of Ohio treats.
When Noah was put on Buckeye Health Plan under MyCare Ohio, Theresa says his case manager told her Buckeye wouldn't cover appointments out of state, and those appointments were canceled. Theresa later learned Buckeye actually did cover them. Theresa says from start to finish that the case manager left her in the dark.
She was very difficult to reach. She took a long time to return phone calls.
Now Noah has a new case manager and is covered by a different insurance company. Still, Theresa says state delays paying providers has scared away so many nursing agencies that Noah has gone 6 months without the level of care he needs.
We did find an agency that is able to cover a couple days of, maybe 3 days of Noah's nursing, even though he's been approved for 7 days a week of nursing.
Noah's medical needs are clearly complicated, and it's cases like his that caused Ohio to start experimenting with MyCare Ohio a few years ago, trying to make coverage simpler and cheaper.
With something like MyCare, why it matters is because most of the money that gets spent in Medicaid and in Medicare goes to these really complex populations, which makes sense.
Lauren Anthus with the Center for Community Solutions says the political battles generally happened around Medicaid expansion in states like Ohio. But really, it's the state's growing population of elderly people and patients like Noah who need a lot of care, who push the costs higher for everyone. Lauren says MyCare Ohio is intended to make the care easier to get for people who need the most help while helping them save money along the way.
The question is this the right model? Or can we improve the model? And I think that that's still an outstanding question.
In Cleveland, I'm Kevin Barry, News 5.